Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. Here's the headline. The VA Secretary says tighter fiscal picture at VA requires careful planning to continue healthcare hiring. Now, on its face, whatever. However, there's two things that are concerning. The influx of new enrollees into the VA healthcare system. If you're not aware, there's different ways to get VA healthcare. One is, to be below the poverty level and be means tested. You're essentially in a very low income situation, which I don't suggest. That's not the best way to get VA healthcare. Okay, but it is a way. The other ways are, you're a former prisoner of war, you have Purple Heart, it goes on and on. There's, 10 different ways that you can get healthcare. By far, the biggest doorway into VA healthcare is service connection. So if you have service-connected conditions, then you can go get VA healthcare. Well, the PACT Act has introduced a lot of new veterans into the world of VA by means of compensation with presumptive conditions, rightfully so, and I'm glad. Now, these veterans who are just getting their first service connections and disability compensation are now able to sign up for VA healthcare. So we're increasing the demand. Well, they need to increase the staffing. Now, that's one influx of veterans. Two is there's a new avenue that's now opened to where the VA is allowing, starting March 5th, I believe, I did a video on this recently, March 5th, allowing any veterans who served in a toxic exposed environment. So not that you have a condition, just that you served there. So you don't need to have any service-connected conditions. You just needed to have served in a area that has been deemed exposed, right? So obviously Vietnam, burn pits, those types of things, Camp Lejeune. So if you served in any of these areas, you don't need to have a condition. You could be fit as a fiddle, totally fine. But you can now sign up for healthcare with the VA starting March 5th. So that's going to increase the demand as well. Okay. Well, now all of a sudden, when you're thinking of that and you read tighter fiscal picture at VA requires careful planning to continue healthcare hiring, it gets a bit concerning, especially when there has been some roadblocks for community care. So now you're being forced essentially to get your care from the VA, which is I guess okay, but one, you should have a choice. Two, well, what if there's nobody working, right? What if you're 30% understaffed? And what if you have these long wait times and I need to be seen yesterday? So let's read through this, see if we can pick out any nuggets and go from there. Hit the thumbs up, subscribe, share with a friend, all that good stuff. I truly appreciate it. Thank you so much for watching. All right, let's jump through this. The Department of Veterans Affairs plans to keep hiring for its healthcare workforce this year, but at lower levels than last year, when it saw record workforce growth, according to some of its top leaders. The VA Secretary told reporters Monday that the Veterans Health Administration is managing its workforce in a tighter fiscal picture, but added that the department is taking a more targeted approach to hiring after the agency exceeded its hiring targets last year. Now, for those that aren't aware, the VA is a three-headed monster. You have the VBA, which is the Benefits Administration, your home loan, your education, your VA compensation, all of that stuff's from there. Then you have the VHA, the Veterans Health Administration. That's going to be your medical centers, your clinics, and so forth, vet centers, all that good stuff. And then you have the third head, which is the cemeteries. So let's move on. Where we're not hiring, it's not because we haven't been able to hire, it's because we don't have a need. Why would we not have a need? Because we just had a great year of hiring, is what he said at a press conference at the VA headquarters. The VA Secretary told reporters last month that as it relates to VHA, there may be times when we determine that there are personnel that we don't need going forward, and that the agency may need to manage its overall headcount through attrition. What does that mean? That means when people quit, you don't replace them. You want a lower headcount? You want to pay less in FTE, full-time employee costs as people leave for whatever reason, whether it's good, bad, indifferent, doesn't matter. Attrition, people leaving but not replacing, is a way to manage your overall headcount if the directive is you need to have less people. You need to spend less. Well, I don't want to go fire people. Well, then as they leave, don't replace, right? So through that mindset, it's a little bit scary. So, and again, I'm going to read that last kind of segment of a sentence. And that the agency may need to manage its overall headcount through attrition. All right, moving on. Federal News Network reported last week that the VHA recently advised medical center leaders and human resources professionals on rescinding tentative or final job offers made to prospective employees. So the rescinding is pretty horrible. Rescinding, taking back, right? Tentative and even final job offers. That's pretty horrific. According to the emails obtained by the Federal News Network, told officials to not only rescind job offers, only as an action of a last result. Okay, let's read that again. So, the VHA recently advised medical center leaders and human resources professionals on rescinding tentative or final job offers made to prospective employees. VHA, the Veterans Health Administration, according to emails obtained by Federal News Network, told officials to only rescind job offers only as an action of last resort. But that's weird, right? So, okay, look, we need you to do this, but only as a matter of last resort. So what does that mean? The only way that I could take that is we need your head count's here. We need it to be here. You have X number of kind of floating job offers out there. We can let those kind of just drag on for the next 6 months if you want. And we'll see if you lose enough people over the next 6 months to then allow those people that we have those job offers to then bring us back up to where we want you to be. I mean, that's the only way. But then the question is, well, what happens if I don't quite get there? Well, then as a matter of last resort, you're going to have to rescind those job offers. I mean, that's just such a weird way. All right, so moving on. The VA secretary, however, stressed to reporters on Monday that there is no nationwide hiring freeze or hiring pause, and there are no plans for a hiring freeze or reduction in the VA healthcare workforce. The idea that we have a hiring freeze is not correct, he said. The idea that we are looking carefully at hiring is correct. Undersecretary for Health Sharif Ellenhall told reporters that VHA will continue to strategically hire in areas where we know veteran care demand will be, and in geographic areas where we know veteran growth is most. So here's the thing. Every year they will do an assessment. There will be kind of a study of sorts on the nation and migration and areas in which they can kind of guess where veterans are migrating to or what have you. So the idea that we're a stagnant, so it is, I'll give the VA this, it's difficult, especially after COVID stuff where it's allowing, people to work in different locations. And not just that, maybe some of us decided, you know what, we're going to hang it up, done with it all, and I'm going to move to some other state where I can buy some land and just be, right? So how many people do that? Well, if you have a big VA facility over here, but a bunch of people leave that area, now you don't need this big facility anymore. So you start to lay people off or what have you, and then it could come across as negative, right? Oh my gosh, they're laying people off, they're shrinking up or whatever it is, but the demand has dissipated. And that's why you're going to also, in some cases, see veteran advocates, right, saying, hey, look, use your local VA or we're going to lose it, right? The more people that use it, the more that it will stay. The more that don't, the more that it won't, right? So it's a slippery slope, right? All right, so moving on here. I've tried to make that clear. This is Ellen Hall, I believe. So he's going on with, I'll just start over. Undersecretary for Health Sharif Ellen Hall told reporters VHA will continue to strategically hire in areas where we know veteran care demand will be and in geographic areas where we know veteran growth is most. I've tried to make that clear to all of our medical centers, clinics, and healthcare workers. We will need to hire fewer staff this year, and again, that is because of the excellent hiring year we just had, Ellen Hall said. VHA hired more than 61,000 employees in fiscal 2023. It's the fastest rate of growth in 15 years. The agency grew its total workforce by more than 7% and now has more than 400,000 employees for the first time in its history. In addition, efforts to boost retention have led to a 20% decrease in staff turnover between 2022 and 2023. Ellen Hall attributed that lower turnover rate to VHA tapping into retention and recruitment incentives under the PACT Act to a very large extent. The PACT Act, signed into law in 2022, expands VA healthcare and benefits eligibility for veterans exposed to toxic substances during their military service. Congress put in that bill, and we asked for those authorities because we wanted to better retain and recruit the best healthcare talent out there, Ellen Hall said. The VA secretary said, VHA did a really good job of hiring last year and, as importantly, did a really good job of retaining providers. That will obviously inform our decision later this year about how we execute on year 2 of the 5 years that we have these special employment tools that came with the PACT Act, he said. While Congress has yet to pass a comprehensive spending deal for fiscal 2024 and must act to avoid a partial government shutdown this Friday, VA and VHA are funded through advanced appropriations. We believe we have the funding we need across VHA in the healthcare system to be able to meet veteran care needs and support our base of full-time employees, Ellen Hall said. We are not in a budget shortfall. We have the funding we need to be able to execute on the veteran care mission. And various leaders throughout the system made projections on different scenarios to be able to manage to that. But I am not concerned about funding issues at this point, he added. Ellen Hall said VHA is taking sensible steps where we can to be able to meet the veteran care mission, most importantly, but also live responsibly within that, within what we expect our budget to be over the next couple of years. I wouldn't differentiate at all what we're going from any organization that has a mission, FTEs and budget, Ellen Hall said. Ultimately, though, I think we have the end strength overall across the system, and we're providing maximum flexibility to our hospitals and clinics to do what they need to do to execute on that mission. VHA is looking to raise workforce productivity after a record year of hiring and increase the number of healthcare appointments available to patients. We will exceed our hiring goals last year. We well exceeded our hiring goals last year, which is a good thing, Ellen Hall said. It means that we are at the end strength that we need to get to be able to serve veterans. And so, just like any organization does, you don't have to have a full-time employee level that is able to meet the mission, and it is supported by the budget, and that's what we're doing this year. Shutdown impacts on VA's veteran outreach to veterans. The VA secretary warns, and let me see what this kind of goes on. Talking about some of the deadlines that are coming up, and I will save that for another video right after this one probably. All right, thanks so much for watching. I really, really, truly appreciate each and every one of you. I hope you have a great one. And remember, if we don't take care of each other, something went wrong.